The problem with the CT scan is because each patient will have about 300 and 500 slices per patient. And in the peak of this pandemic, each hospital will host hundreds of patients per day. By manual labor, it is impossible to process such a large volume of data in their shift. So that's why we reduce the quantification of the pneumonia from 2 to 3 hours to 2 to 3 seconds. And that's how we help most the hospitals in Wuhan to process all the CT scan images very, very fast. And actually, we have lowered the death rate because we evaluate the severity of this disease automatically. We optimize the allocation of the precious ICU resources. We release the ICU resources to the most severe cases, and we kind of triage those ones with mild infection and the moderate infection to the isolated wards. Let me explain a little bit like why the follow-up feature is necessary in the clinical guidelines for treating the coronavirus patients. Because once the patients are confirmed with coronavirus cases, then some may get worse. So the infection in their lungs are getting worse, and you need some. So in the clinical guideline in China, those confirmed cases needs to take CT scan every 3 to 5 days. So multiple CT scans will be taken, and our solution can automatically evaluate the progression of the disease. And some of the patients will be under recovery, and the lung infection will get smaller and smaller. And either way, you need a solution to automatically evaluate the progress of the disease. And that's what the follow-up feature here is doing. In the front end, so when the doctors open the PACS viewer and to see the CT scan images, everything already been done. So when the doctors open the PACS viewer, it will see what you saw before. Whatever you see here, it's already shown up on doctor's screen because it's already processed by AI algorithm in the back end. So basically, long story short, from the beginning that the patient goes to the contamination room to do the CT scan till it comes out waiting for the diagnosis report, that process takes about 30 minutes. And during that 30 minutes, all the AI analysis already been done, finished.